Hello, my name is Joel Dunning. We're here at STS 2024 with a hero to so many of the residents and people out there, Amy Fiedler. So great to have you here. Thank you so much for coming and talking to us. Amy, you're Associate Professor at UCSF. You're a heart transplant surgeon. You led the first ever all-female transplant team, which I just love. That was, great breakthroughs. And just everywhere you go, you seem to sort of rip up the copybook and help everybody. So, and you're actually in a session all about advice and tips for early stage career surgeons. So maybe just literally tell a little bit about yourself, about how you started off, how you got into cardiac surgery, and take it from there.
Yeah, well, thanks for having me, Joel. It's really a pleasure to talk today to the CTSNet community. So I'm Amy Fiedler. I'm a heart transplant and adult cardiac surgeon at UCSF in San Francisco. I guess a little about me is that I grew up in Michigan. I never thought that I would be a cardiac surgeon. Grew up running track and running cross country. I went to Georgetown for undergrad and then GW for medical school. Again, entered residency then at MGH in Boston and never considered cardiac surgery. I thought I would be either a pediatric surgeon or a surgical oncologist. Within the first couple of months of internship, it was pretty clear I was not going to be either of those. Spent a lot of time on the cardiac surgery service as a second-year resident and fell in love with the specialty. The kind of story goes from there. I joined the 4-3 integrated training program at MGH. I graduated from MGH in 2018, and I've been out in practice ever since.
Absolutely fantastic. And so what got you into cardiac surgery then? What was that thing that just made you sort of love it?
Yeah, so I think I was always drawn to big open surgery, so that was part of it. And I always was fascinated by transplant. I had only seen abdominal transplant previously, but when I saw my first heart transplant and then a lung transplant, I was completely fascinated just by the empty chest and then organs filling it, the heart restarting. It was contagious, and so I fell in love with it there, and also the cardiac physiology in the ICU, and I decided there was nothing that I would rather do.
Yeah, and I'm a Brit, so I don't know too much about your US system. Was it difficult to get that first residency, that first foot in the door?
So that's a great question. There's so many different ways to enter a cardiothoracic training program right now in the United States. So there's the traditional pathway, where if you're not entirely sure when you go into general surgery, you complete your general surgery and you go into the traditional pathway of cardiothoracic surgery after that. There's an integrated training paradigm where some general surgery programs have cardiothoracic surgery training built into the general surgery, so you can become board certified as both a general surgeon and as a cardiothoracic surgeon. Or there's the I-6 training paradigm where you finish medical school, you're very confident in your decision to become a cardiothoracic surgeon, and you enter the program that way. So for me, I was lucky. Even though I had no idea I wanted to be a cardiothoracic surgeon when I entered general surgery residency, my training program did have a 4-3, and I entered that 4-3 during my time as a general surgery resident.
I guess these things are pretty competitive. Do you know the figures? Is it like 6-1 or something, or you just have to try your hardest?
So I don't know the figures, although last night I did hear a statistic that we are now as competitive as pediatric surgery, which is historically in the United States one of the most competitive specialties to match into after general surgery. So I think you really have to be confident that you're putting your best foot forward when you're applying to our specialty.
Yeah. Any hints and tips on what to do? Just work hard, try and get papers.
So that's a great question. I get asked this all the time. I think one, having a passion for the specialty, really understanding what you're getting into in terms of being a cardiothoracic surgeon. You can learn a lot from watching videos on CTSNet, exploring some of the scholarship opportunities available via the TSF or Women in Thoracic Surgery. So get that early exposure. Also find a mentor. Find a mentor either at your home institution or use Twitter, social media to find someone like me who's not at your home institution. And I'm always happy to chat with medical students and residents if they don't have someone where they're at that they feel comfortable talking to, and explore research. There's a lot of research opportunities out there. Get your foot in the door with research and publish some papers and come to meetings like this. This is an amazing networking opportunity and a chance to collaborate and learn from folks all over the country and the world.
And you actually did a TSR fellowship, didn't you?
I did.
Which is great. So was that easy to get, or how did that go?
So it was, I don't know how easy it was to get. I applied, but the funding opportunity opportunities are seemingly endless now for folks who are interested in our specialty, and they continue to grow. And I will say that I have been the lucky recipient of many TSF funding opportunities throughout my career. From when I was a general surgery resident, I was a Braunwald fellow. I had that to support my research in the lab. I was a Fontan Traveling Fellow recently, and I also have a double ATS Career Advancement Award too. So there's lots of different funding streams for individuals who are early career who are interested in moving their research program forward.
Great, and let's take this next big step, resident to actually attending.
Oh gosh,
so
yes.
yeah, was that the biggest step you ever did?
Yes, it's the biggest step that any of us will do. And I like to tell people that the first year I was an attending, any night that I was on call, I just laid awake in my bed praying that there would not be an aortic dissection. And then you finally get over that. But it is a very, very challenging time when you make that leap from being the fellow to being your first attending job. And I would say that when you're evaluating your first job opportunity, it's so important to have good mentors and support within that institution, because you're always going to feel like you don't know what you're doing, no matter how well trained you are, until you really get your feet under you, and you'll need the help and support of your partners to get there.
So the number one tip was choose a job with really good people that can come and help you for that first dissection, I guess. Yeah. Did you get a bit of help for that first one?
I did. I have. I've been very fortunate to have great partners throughout my early stages of my career here that have been incredibly supportive in my development as a surgeon.
Yeah, fantastic. And we've actually heard some, really, quite shocking news about the differences in pay between male and females, but actually we've also heard some really inspiring things as well, that actually the STS are going to help. And they've said very similar things to you. Get other people around you, use the statistics around. So what do you think we can do about this pay disparity? And do you think there is a way that we can get rid of this in the next few years?
That's a very, very difficult question, but I think the way that we can initially start to address it is with this survey, and bringing the data from the survey to our institutions and to our bosses and saying, there is inequity, and if we have inequity within our divisions or our departments, that needs to be fixed right now. Dr. Cerfolio said that during this session when the survey on compensation was presented, and I couldn't agree with him more. Once we have equity across our divisions and our departments, then we can start looking at the actual numbers and being sure that everyone is compensated fairly into our market value.
Yeah. So now I guess you're a few years into being an attending.
Yes.
So are there any good hints and tips you've got for people sort of as they're in their first 5 years, how to survive it?
Yeah, it takes a village to survive being a cardiothoracic surgeon. I think it starts with finding the right opportunity for yourself, having supportive partners at work, friends and family around you, taking care of yourself as a person. I'm also an avid endurance athlete, and I think that helps keep me grounded in times when things are stressful and busy at work. As you move through your career, lean on your mentors and your friends. Think through your objectives in terms of where you'd like to be in the next 6 months, 1 year, 3 years, and make a plan. You can deviate from that plan, but it always helps to have a roadmap.
And finally, I'd love to hear about your charitable work. You're an amazing person that's now sort of doing a load of work in Rwanda with Chip and Sia Bowman. Tell us a little bit about that and how that's helped get through.
Oh yes, that's very near and dear to my heart. So Chip and Sia Bowman are two of the most incredible individuals that I've ever had the opportunity to work with. They founded a nonprofit organization called Team Heart, which has been providing cardiac surgery for rheumatic heart disease in Rwanda now for over 12 years, with a huge impact in terms of patients saved and impacted through cardiac surgery. So I've been fortunate enough from training in Boston, having the opportunity to meet Chip and Sia, and then starting with Team Heart when I was very early on as a general surgery resident, progressed with the organization through my cardiothoracic surgical fellowship, and now I travel once to twice a year as an attending cardiac surgeon as the surgical lead of Team Heart, providing cardiac surgery and trying to create independent cardiac surgery in Rwanda.
Yeah, and certainly our department does missions, and I think it just changes completely your outlook on life, doesn't it? If you bring colleagues, you come back a different person. Would you agree?
Oh, I would absolutely agree. You come back a different person, and you come back completely reinvigorated for the specialty and for what we're doing for our patients each and every day.
Yeah, we should make it compulsory, shouldn't we?
I think
Everybody
we should.
should go
Everybody
out
should do
right
it, for
now.
sure.
Yeah, absolutely. So great. Well, thank you so much for coming to talk to us.
course.
It's a real pleasure, and I hope we can meet many times over your fabulous career.
Oh,
and
thank you, Joel.
we will watch it with great interest.
Oh,
so thank you so much for coming to talk
Thank you.
to
It's
us.
my pleasure.